We are really fortunate today to have Dr. Michelle Snuggs. Michelle is the Chief Director of the Shannon Women's Imaging Clinic in San Angelo. Her primary focus is breast cancer.
As you know, breast cancer, I hope you know, it can occur at any age. Typically, it's going to increase as we get older, obviously, but 1 out of 5 women will be diagnosed in their 40s. To me, that's a pretty big percentage. And only out of those, only 20 to 25% are hereditary. Overall statistics, 1 in 8 women will get breast cancer before they're 85, and it's only to lung cancer causes the cancer deaths in women. However, that being said, the mortality from breast cancer has been going down since 1990. The statistic here is about 3% if you're below the age of 50, and about 2% if you're a little bit older. So obviously something is working. Now, mammography is not perfect, but it's the best thing we have right now to save lives. And through screening with mammography, with all of the new treatments that we have out there, I think that's what is actually contributing to the decrease in mortality from breast cancer. So the key to breast cancer, or diagnosing breast cancer, is early detection. And what does that mean? That means you're doing all you can to help either prevent it and or detect it early when it does show up. By doing that, you're going to want to do 3 things. That self-breast exam, which you should be starting in your 20s. Clinical breast exam also is very, very important when you're at your doctor's office, and normally that will start in the 20s and at least every 3 years, starting in the 20s and then yearly as we get older into the 40s. And then obviously mammography. But this is the physical exam from 20 to 40 every 3 years, and after 40 you should be having your doctor examined every year. Early detection mammography, like I said, is not perfect. We miss probably about 15 to 20% of cancers just by mammogram alone. It is still the best thing we have right now for screening. And there may be something that comes out that replaces it, but right now, for the low dose radiation that we use, this is definitely the best test. Some of the risk factors I listed here, family history, again, plays a part, but it's not the whole picture. Early menopause, early menarche, late menopause is a contributing factor, and you're asking, well, why? Well, what they believe is that if you start your period early and or have a later menopause, your body is exposed to that estrogen just that much longer. Also, healthy eating, you want to do that. Obviously alcohol use in moderation, and even smoking can contribute to breast cancer. Breastfeeding also helps reduce the risk of breast cancer. Okay, here are some of the signs and symptoms that you should be looking for. The most common is going to be a lump, and what you'll feel typically if it's cancer, it's going to be hard, it's going to be fixated, it doesn't move inside the breast. Other things, inversion of your nipple. If your nipple has always, I'm just going to use layman's terms, is sticking out and all of a sudden it's not anymore, it's inside, that is something that needs to be addressed with your doctor. And the reason being, and kind of with the skin dimpling, like if your skin is poking in, or if there's a little indentation into the skin, what happens with cancer, it sends out these little hard tentacles, almost, for lack of a better word, and it pulls against all of that normal tissue in there. So if it's close to the nipple, it's going to pull that nipple in. If it's close to the skin, it's going to pull your skin in. So if you notice anything like that, or your breast turns red, if you notice a big increase in one breast versus the other, so if you do notice a change in your veins and or your vessels around the skin of the breast, that's something to be concerned about. That's kind of rare, but I have seen it happen before. The most common is an abnormal mammogram. Most women do not come in feeling their cancers. Okay, 15 years ago, probably. But with mammography nowadays, if you're coming every year, more than likely it will be picked up on mammography. And it'll be small. There is no way you're going to be able to feel it. The second most common reason is going to be feeling the lump. And typically, if you feel a lump, it's going to be bigger than what we would be able to detect on the mammogram, and/or it's going to be close to the skin. And the reason being, obviously, it's more superficial. You can feel it versus it deep down into the breast, and you can't feel it until it gets big enough. Some of the less common things are the skin changes, discharge, which I didn't go over. Basically, you don't want to wear any deodorant and/or powders or lotions over the breast area or under the arms. And we tell that to women all the time, like, why do you need that? I'm going to smell bad or whatever. The deodorants and some of the lotions and powders have aluminum in them. And when you see aluminum on an x-ray, it looks like little calcifications in the breast and or under the arm. And that's one of the signs that I look for on a mammogram for cancer. So we usually say wear 2 pieces. That way you just put on a little gown, you keep your pants on or your shorts on or whatever. If you do have films done or a mammogram done somewhere else, say you moved here from Dallas and you had your mammogram there the last 3 years, we need those films because I look, I compare, I want to look for change. So it's very, very important to either bring them with you or when you get to the facility, fill out a piece of paper and say, yes, I do have films. How are they performed? Basically, you'll undress from the waist up, you put on a gown, you usually go into a little sub-waiting area and the tech will come get you, and it'll be you and the technologist in the room, and she will perform and position one breast at a time. We end up doing 2 views on each breast, a total of 4 pictures. The x-ray that they take now, it appears on a computer screen inside their room, so they just walk over and they look at your image and they say, great, you got good muscle, there's no motion, okay, move on. And so that's how they do all 4 of those. And as soon as they get their pictures and they look great, they push a button, all of the images are sent to me in my other room on my computer screen, and you're gone. So this is actually a mammography machine that we use over at our facility. And this is just one of our mammography rooms, and I did this so you can see, this is the screen that will pop up with your image. Are mammograms painful? Well, they shouldn't be painful. They may be a little uncomfortable, and it's kind of like what I tell women is if you were going to squeeze your arm kind of tight, it doesn't bruise and it doesn't hurt, but it's uncomfortable. You don't want to stand like that too long. Luckily, it only lasts a couple of seconds. If you do bruise, if you get a skin tear, if it hurts, that's not good. I mean, it should not happen. If you were going to come in and you are having breast pain, or you have breast pain all the time, or you have breast pain during your period, normally the best time to schedule this is the week after you start your period. That way everything's pretty much calmed down. If you still are having breast pain, take a Tylenol, some Advil or ibuprofen about an hour before you come in, and that might actually help if it's uncomfortable. Typically, once I get the images, I look at it, I will review it, I come up with a report. The report will go to your doctor. We, as a facility, are required to send you a letter to let you know that everything was normal, or that you need to come back, or you need a biopsy. And your doctor sometimes will also send you a letter as well. If you don't hear from them, though, don't assume everything is normal. Call your doctor and find out exactly the results.